My name is Michael Ayers. I'm an orthopedic surgeon. I work for South Shore Orthopedics, which is located in Weymouth, Mass. And I work exclusively at South Shore Hospital, also in Weymouth, Mass. My practice is focused on adult joint reconstruction, which is primarily hip and knee replacements. But I also take trauma call at the hospital and do both adult and pediatric trauma, as well as a little bit of general orthopedics. My decision to go into orthopedics was probably somewhat driven by familiarity. My father's an orthopedic surgeon, so I was aware of orthopedic surgery and its pluses and minuses. And I have a mechanical background. I built a boat as a teenager, and restored an old military Jeep. So I like working with my hands. As all it's corny, but the adage goes. I mean, that's what we do, is very mechanical things in orthopedics. So I enjoyed that, and that kind of led me to what I enjoyed in medical school, which is orthopedics, which is why I pursued it. Studies have actually shown that doctors interrupt patients probably in the first 15 seconds that they talk. So, intellectually aware of that, and just my personality, I try really to listen to the patient. If the patient's given the chance, they'll usually tell their story and often lead us to diagnosis. So I make every effort to basically try and let the patient tell their story. And I think that's what I try and do to do the best at my job. It's partly what I say, but it's partly what I do. I mean, I tend to be very sort of open and approachable to my patients. I don't wear a white coat, and I try and create a comfortable environment. I always sit down when I talk to my patients because I want to be an eye-to-eye level and be able to make eye contact. And in this high-tech age, I actually have gone to using a scribe because I prefer to listen and talk and have the interaction with the patient. So I have someone else in the room who basically records the visit on the computer, so I don't have the computer between myself and the patient. And I find that's been helpful to my practice. For me, the best part of my job is really the people. I am guilty sometimes of getting a little behind in my schedule, and my medical assistant will often need to nudge me along because I might be talking about fishing with a patient or woodworking with a patient, because while the goal is medicine, I care for people, and that's what I like, and I like getting to know the people, and that's really where I get the charge out of my life. A lot of what we do is hard work here, but we get to meet some people and get to know them, and that's really a special privilege really that we have in caring for people. Surprising about me, I graduated from college with an economics degree, and I sold investment real estate for 5 years before going to medical school, which is probably not unique, but an interesting preparation for a career in medicine. And just generally, I'm a husband and father. I have 3 teenagers, and I live in this community because I love the water, and I like to spend time fishing and pulling my lobster traps. My commitment actually that I only work at South Shore Hospital is because I think it is really a great place both to get care as well as to work. I have utmost respect for my colleagues there. I think we've developed a team of some really talented specialists, and primary care doctors there who do a fantastic job caring for people. It's where I take my family. And I think, I feel comfortable taking my family there, that they're going to get the best care. And I think it's in our community, and I think the mission of the hospital is to provide for care of the community. I think they've done a good job in doing that.